Thank you for joining us. My name is BJ Murphy, publisher of NeuseNews.com, and we're excited about the 2020 general election. We're doing our best to bring you interviews of all the candidates, but first, don't forget that early voting starts on October 15th and Election Day is Tuesday, November 3rd. In fact, as always, you can join the News team on Tuesday, November 3rd at 7:30 for our Facebook Live election coverage. We've gone as long as 4 hours. Actually, it was 5 hours, if I'm not mistaken, and as short as an hour and a half. But we start right at 7:30, and we will take you through all the results that evening. And this year is special because we got the president, the governor, NC House, NC Senate races, and a lot of other local races. And today we're excited to be joined by Dr. Donna Lake, who is running for North Carolina Senate. Thank you so much for joining us today.
Thank you. It is wonderful to be here.
Well, tell us a little bit about yourself.
Certainly. I've been living in eastern North Carolina for 15 years. I got here through the way of Seymour Johnson Air Force Base, and I had retired in 2007 after 25 years of service. I was the medical group commander at Seymour Johnson, and we traveled around. My husband Bob is an Air Force pilot, retired, and we have 2 children that grew up in Goldsboro in middle school and high school. And when I retired, we grew roots, and I was recruited by East Carolina University, and I've been teaching there for 13 years in the College of Nursing and also in Brody School of Medicine. Mm-hmm. But I got here as fast as I could. Mm-hmm.
Well, we're certainly glad to have you in East North Carolina. So let's talk a little bit about this race and some of the most frequently asked questions as we've heard them on the street. And let's just talk with, let's do the first one. Why are you running for the seat?
Well, it was something that was not on my bucket list, to be honest with you. I am a nurse for 44 years, and spending those 25 years in the Air Force and now teaching. What I was doing when I was teaching was taking students to the assembly and also working on a lot of projects for healthcare for Eastern North Carolina. So for 8 years, I've been sitting in that back row listening. And the more I was listening and then seeing what was happening in our community, I felt I had a skill set that could really make a difference. And I think during COVID and post-recovery of COVID, we need to have leaders that are agile and have a deep bench of experience. And I feel I have that skill set.
Well, let's talk a little bit about COVID and teaching. So let's talk a little bit about education as it deals with reopening schools. Tell us a little bit about your thoughts about how to reopen schools safely and certainly how that impacts high school sports and even college sports.
This is a really important time, and a global pandemic means that we are in a time in our life that is very complex. Media moves very fast. Knowledge moves very fast. As a nurse and as a PhD scientist, I look at data. I look at community data. What's the impact to population? Some of my dissertation work was on adolescents in schools, and I teach online also at ECU. So for the teachers, the parents particularly right now are struggling with how do we manage? Do we put children in school right now? Where is that COVID infection rate? What's the impact to children? How does it impact the staff? How does it impact sports? How does it really keep people safe? So I'm from the philosophy that we have to talk and collaborate. Parents, teachers, and staff and administrators. What is best for our community? What may be best for Wayne County may be very different in Lenoir County. So I don't want to tell the folks in Lenoir County how they should do their business. But what I would say is we have to be very careful. If we have large class sizes, we need to spread them out. If we need to keep the rooms clean and we need to wear masks, we need to do that. Also, teaching online is not very easy, and I know that firsthand from doing it. So we have to prepare our teachers for that. I have to tell you, I'm hearing our teachers are very stressed as well as our parents. But I will also tell you our children are stressed. We can't always keep them isolated. So I guess what I'm telling you is in sports, we have to be very mindful of what is that infection rate and contact rate. Obviously, big difference in golf compared to football. And we have to look at the timing of the flu season. We have to really look, what is that impact of the flu season going to be on COVID? And I don't know that. I don't know what that's going to be. So I think we need to keep talking keep planning collaboratively, and we need to be looking at the data. I try very hard to watch how we're testing in our communities, what's our tracing, and how is the community responding. I hope I answered that.
And speaking of schools and kids and virtual learning, a lot of this district, which for those that don't know, the district is all of Lenoir County and all of Wayne County, correct? And so with that district, you're talking about rural eastern North Carolina, and you're talking about internet access. Tell us a little about what would you do to help increase reliable broadband internet through the rural areas?
That is real close to my heart. In fact, we had trouble with our bandwidth just this week in our computer system, and they are digging our front lawn as we speak. So bandwidth is a very big thing. Teaching 13 years, graduate nurses already practicing. I teach online, not Zoom necessarily, but online. And I have struggled in Eastern North Carolina for over 400, 500 students that didn't have the right bandwidth. And I know as the adult learners were having trouble, I can only imagine the children having trouble and the parents. We do have an issue with bandwidth. I also think and listen about the farmers. Some of them have incredible need for accurate information in their cabs, in their equipment, but when they go up to the house, they can't use the computer because they don't have the right bandwidth. So I am hoping and promoting more like a utility where all of us can get some type of bandwidth and be able to access it. The hot spots aren't enough. We need to be able to have it into the house. When I study the European countries and others internationally, they bring it to every home. They're able to do that, and I believe we can do that. And our cities, our Charlotte and Raleigh, we have to get it in Eastern North Carolina because we don't want to hold back our children, our businesses, our farmers.
Well, let's talk about the state budget a little bit.
Okay.
Last year, there was a lack of a budget passed last year, and now you've got the impact of COVID this year. What kind of impact do you think that's really going to have? And, if necessary, what types of cuts would you recommend?
I have learned a great deal. I've been campaigning 14 months, learning, listening, studying, and talking to people in the know, and then the average person on the street like myself trying to figure this out. Our budget is extremely high, for sure. But what we need to do is to make sure that we are agile as legislators and government representatives of the people. This bipartisan arguing and bantering back and forth, we need to move forward. And I feel with my background in the military, I'm a collaborator, I'm a bridge maker. I look at finance. I've been in charge of healthcare systems, $125,000 just small contracts, and some of the jobs I've had where we had to really make sure, excuse me, we have to really make sure that our budget is accurate, it's for the right reasons and the right priorities. So I want to get back to your question. We must sit down and figure out where do we need that money spent right now, COVID-19 and recovery. I'm an optimistic person. We're going to get past this. But we have so many people out of work. We have small businesses that are struggling. We have farmers that are struggling. We need to figure out how to spend that money, build that sound budget, and collaboratively, not just a majority, but collaboratively sit down and what is right for the people of North Carolina. And I would say, what is right for District 7?
So let's talk about a political hot topic, and that is discussion of voter ID. It was passed through the constitutional amendment, I believe, a year or two ago. It's been challenged. What is your position on that? What would you like the people to know about your thoughts on it?
When I retired in 2007, I was getting ready to teach health policy, and I was told by a very saged professor, she goes, you can't teach that until you understand how voting works in your community. So I did. I became a precinct captain. I started to see the challenges of how do you get out the vote, and then how do people come to the voting booth. What I learned is many of the people in our community don't actually have an ID. And we have such an older population, and I mean older population, in the 90s, 80s and 90s, and they don't have the right ID. So my concern is if we put that ID in place right away, that will leave people out and they won't be able to vote. So that's a concern that I have. I think over time we can work forward, but right now I don't think it is ready.
All right. Well, I've got probably a dozen more questions I could probably ask, but in the sake of time, won't you give a little bit more of kind of a final thoughts, final things you want the public to know about Donna Lake and why you're running, or any other issue we weren't able to chat about today?
Well, first, thank you very much for this time. I really do appreciate it. You know, I come from a small town in Long Island, New York, maybe 26,000 people. You would think coming from New York, I'd be from the big city. I'm not. My father was in construction. I started working at 15. I've been a nurse since age 20. So what I want people to know is that I've worked very hard. I know the kitchen table issues. I know what it's like not to have money. I also know what happens when people lose their jobs or when they don't have health care. And in a crisis, that leaves no room. So I am a champion for what the people are talking to me about. I've spoken to more than 1,000 people one-on-one over the last 14 months, particularly before the pandemic and then now during the pandemic. And what I am finding is healthcare is number one on everybody's mind, and that is accessible healthcare, affordable and safe healthcare. I know Kinston's healthcare system extremely well. I worked on grants here with the health department and also the community health center, and I've worked with the hospital. I know the needs of the people when it comes to healthcare. Education, I am teaching the next workforce. I am really trying to build the next healthcare workforce so we can take care of our people in Lenoir and Wayne County. So I want the folks to know that I am a champion of those issues, but I also have a very strong business mind. And I've been a very strong leader in the past. And what I do know is we need better economic development, we need better jobs, paying jobs, but we also need more apprenticeships where we can build strong jobs for those that can work and want to work. And we have so many people that just do not have the right skill set, and we need to work on that. We need a stronger educational system in the classroom. We have to bring self-confidence, decision-making, education, so our young people can decide what jobs they want to do in the future, so they can have a better quality of life. When people in Kinston and Lenoir County cannot pay their rent, that's a concern. We have to look at how can we help the people of our community, all the people in our community. So the bottom line is, I'm a proven leader. I fight hard. Being in combat, you learn a lot. Being and seeing the price of democracy. I've seen the price of democracy. I've seen people die. I've taken care of hundreds to thousands over my 25 years. And that's sincere. That's not just political talk. And I'm fighting for a stronger democracy, a stronger government, integrity. And I'm a leader that has proven I can get the job done day one. And that's my goal.
All right. Thank you, Dr. Lake. Appreciate your service. Appreciate also your willingness to run for office. I know it takes a lot to do just that.
It does.
Well, and for everybody who's watching at home, please make sure you share this video, add a comment, tag a friend, somebody who you think needs to see it. And don't forget to bookmark on your calendar Tuesday, November 3rd at 7:30 p.m. right here on Facebook Live with Neuse News. We're going to bring you the general election results show that evening from 7:30 until, and we want to say thanks to all of our sponsors for making that happen. You'll know more about them as we go along. But don't forget the early voting starts on October the 15th. Please make sure you exercise your right to vote. And if you haven't done so, go to ncpol.com and subscribe to our daily newsletter. It is free. Everything that you click on with Neuse News is free. It's paid for by our advertisers, so thank them by clicking on them or seeing them in the grocery store and saying thank you. But all that is free, 7 o'clock every morning in your inbox, all the day's top headlines. In fact, even if you want to have more of a breaking news when the governor makes a big announcement or a local event happens and you want to find it out immediately, make sure you subscribe to our breaking news text alert. Just text the keyword NN to 484848 and you'll be a part of our breaking news text alert as well. So again, thank you, Dr. Lake, for joining us.
Thank you.
I wish you the best of luck.
I appreciate it.
All right, make sure you get out and vote. Thank you all.